you did touch on the impact of COVID-19. I just wondered what your perspective is on what impact COVID-19 has had on innovation. Obviously, in the UK here, we've had, telehealth has kind of rocketed in terms of going up from around 10% adoption to around 90%, I believe. Is there any more that we can do ahead of the potential next wave as well on that
Yes,
front?
absolutely amazing how healthcare systems across the world have really responded to the crisis and started to use innovation and technology in ways to support patient access. There is definitely more to be done. My challenge to healthcare systems across the world is please don't think that you've ticked the innovation box. We've only just started. And I'm going to give you an example as to why. So if you're a practicing primary care physician and you now see your patient remotely through consultation, that starts the journey of the pathway. But that patient may be coming to you with heart palpitations that maybe need an ECG monitor, with a mole that needs checking, with chronic pain that might need physiotherapy or acupuncture. And actually that onward referral for either diagnostics or treatment may not be available as a consequence of the current crisis. And what we've seen actually is an increase in healthcare professionals not just using telehealth and teleconsultation, but now also recommending digital therapeutics to deal with that next stage on. So a diagnostic tool for you to monitor your mole and do a mole checker, a product to be able to remotely check your ECG and your heart rate, or a pain management app to deal with chronic pain. And I think that this is where we're moving to now. And what we've seen from ORCHA's perspective, we have about 400 digital health libraries and formularies internationally. And what we've seen is a significant increase in people using those libraries to find high quality solutions. But the biggest increase has been around the number of recommendations or prescriptions of apps and digital health solutions to their patients, where we've seen an increase of 6,500% since the start of the crisis. So healthcare professionals are actively wanting to get these solutions to their patients, particularly for people who are vulnerable and having to manage their health at home.